So we're going to talk about user experiences. So I'd like to invite Cindy Rogers to come up to the front and join us. Cindy is the hand hygiene coordinator and data support analyst at Hamilton Health Sciences, and HHS was the beta site for the testing of the HandyAudit system. So Cindy, we're looking forward to hearing your experiences with this at HHS, and welcome. Thank you.
Thank you. I really appreciate the invitation to come here today, not only to launch the HandyAudit project, but also to be able to share my experiences with you. We've had the HandyAudit at Hamilton Health Sciences for almost a year now, and I've been using it personally for about 9 months. Fortunately for our infection prevention and control team at HHS, we have a manager who is very innovative and always looking for new ways to provide efficient and effective ways to provide service and to support patient safety. Cindy O'Neill is our manager, and she's here with us today. And she scoped out HandyAudit at the OHA conference in November of 2009 and was very, very gung-ho on getting this for our organization. And when I came on board in March as the hand hygiene coordinator, I had the opportunity and the privilege to start working with the HandyAudit team right from the beginning and implement this for our organization. So it's been an interesting experience. When we actually got the tool in early April, I remember the day that we got the box. It was like Christmas. And we got the box and I opened it, and because I've never used a PDA before, I took it home and charged it and I played with it, and as I said, because I've never used it before, I fortunately had Caesar's help to help me undo the things that I shouldn't have done to it. So it's a great tool, it's very user-friendly, but the team is there to support you in any way that you need it. So once I got to use it and play with it and see all the great things it could do, I started implementing it right away. I think the best things for me in it, and I'm the one that carries it in my purse, is that when I just take my purse with me, if I have a meeting at one of our sites, I just take it out and I'll go to a unit that I know maybe is having a cluster of VRE, or that I'm behind a little bit on audits, and I'll take it with me and I'll take it out. It's very convenient there for me. It's sleek and handy, and actually it's so sleek and looking like, as Jeff said, it looks like his was it your Apple? Oh, yes. Well, I accidentally took my camera to work with me one day instead of the HandyAudit because the case is identical. So, and I bring this story to you because I had to turn to paper that day. So I didn't want to abandon the audit, so I got out my paper, and then when I had to go back to the office and actually data enter that paper, that's when I realized the luxury of having the data on the SD card. And I was like, wow, this really makes a difference. It really saved me time just taking that SD card and plugging it in and having the data there right away. And the other great feature that we find at HHS is that we are doing the on-the-spot feedback for pretty much everyone that we audit. And because even though the HandyAudit tool does eliminate most of the subjectivity, as an auditor, you still need to know when someone has missed an opportunity. So when I'm giving feedback now to healthcare providers, I can show them the tool, the screen, and say, do you realize that you've missed an opportunity for hand hygiene? And I can show them the evidence. And I can say, here's where you touched a patient's environment, and here's where you've gone into another patient's environment without cleaning your hands in between. And the healthcare provider will say, you're right, I didn't realize that I did that. So that's been hugely valuable for us. The other thing is it's not threatening to employees. They say, wow, what is that you're using? They said, well, that's much better than the clipboard that we've seen you come with before. So they look at it as a support now instead of a policing. So it's very convenient that way. And it will come with a belt clip now because I dropped mine because it didn't have a belt clip before, so thank you for providing that. As Mike said earlier, the magic really does happen with the reports. It really wasn't until that piece got put together that I realized how simple it is now when all this data goes wherever it goes, and I'm not an IT person, so I really value what Mike and the team does to create the reports, because now they're there like magic. That really is what it's like. And now we can use this as our key indicator and put it towards our balanced scorecard for health and health sciences. And now that we know that this is reliable data, that we're comparing apples to apples, really, that hopefully we'll all be able to look at where we are in our hand hygiene rates. And last but not least, I'd like to mention about the customer support from the HandyAudit team. My entire working life, I've been in service. Right from when I was 16 years old, I've worked in hospitality and I've worked in retail, and for the last 20 years in healthcare. And I think I have very high expectations as a customer, and I think I've been a very demanding customer for this team. And we work very closely together that Caesar, Mike, and Janice, I'm privileged to work with them, and I actually like to call them my friends. And they've been there for me at every turn, from very simple requests to something more complex. And we've done a lot of brainstorming together to work towards making this tool better for our patients and for our staff and keeping people safe. So at this point, I don't know what I would do without it for my audits. So I really hope that everyone has the same experience as I have with using the tool, and especially with working with the team, because they're absolutely fabulous. And I get a response, if not within seconds, if they're busy, within an hour, at least to let me know, we can address your request at this time or that time. They've just been fantastic, and I'm just very grateful that Cindy found this tool and that we were able to be a beta testing site for it. Any questions about our experience at HHS? Yes?
How were your rates? Have you noticed there's been an improvement?
Our rates are improving incrementally. I think because the methodology of the HandyAudit, it's very strict methodology. And actually, that's a really good question, because it helped me to realize my own biases as an auditor. And so that now that I can see that, it's really making me focus on exactly what the 4 moments are. And I think that if everybody is using this tool, we'll all be really looking at specifically those 4 moments. But definitely incrementally they are going up. But I think one of the key components to that is providing the feedback, and the HandyAudit definitely has been a huge help in providing evidence-based feedback to the employees. And also being a non-threatening auditing tool. Any other questions about our experiences?
Can I just add to that? Because Hamilton House signed it. I'd just like to add to that, because Hamilton Health Sciences has 4 acute care hospital sites, and so one of our challenges with the Ministry of Health and Long-Term Care tool was that it was really hard for us to get out the individual hospital rates. We were able to get an overall corporate rate, but challenging for the individual. And we actually wanted to drill down further to actually get the clinical unit rates as well. So the paper tool is not very user-friendly. Having HandyAudit and having the back part to be able to generate the customized reports allows us to get those reports out a lot faster and a lot easier. And we will be able to export it into an Excel and hopefully allow that data to be imported into our scorecards. So this has really helped us with the back-end piece for the generating of the reports, and has saved a lot of time.
Actually, we do have a couple of questions online, but they're not related to your user experience, so I'm just going to hold them until we get to implementation.
Okay, thank you.
Okay, thank you so much, Cindy, for sharing your experience. It's definitely a ringing endorsement of the product and the system, so I know that you're all excited to try it soon.